Thank you, Christy. A new year means it's time to begin scheduling your annual health exams, but don't forget about your vision checkups. January is Glaucoma Awareness Month, an eye disease that many people may not even know they have. Dr. Brent Wallis from People's Health joins us now to discuss some signs and symptoms to look out for. Good morning. How you doing?
Hey, I'm doing good. How about you?
Good, thanks. Friday, always good. So let's talk about glaucoma. What is glaucoma for folks who may not know?
Sure. So glaucoma is actually it's a group of related eye diseases that all include an increased pressure in the eye because you're not able to drain fluid like you normally would from the eye. And that increased pressure actually can build up and cause damage to the optic nerve. So if you damage the optic nerve, you're obviously going to have problems with your vision. There's about 3 million people in America that have glaucoma, and about half of them don't even realize that they have it.
So, I mean, you say that's kind of concerning. What are some of the symptoms? How can people maybe know what's going on?
Yeah, there are a couple of things to look for. Like I mentioned, a lot of them don't have any symptoms at all, but you can have some slowly progressive worsening vision or maybe blurry vision. Some people will actually see halos around lights, especially at night when they're driving. You may have a little bit of trouble focusing or maybe even a loss of peripheral vision. So that's where you can't see on the sides. That's really a hallmark of glaucoma or damage to that optic nerve. The one thing that is very concerning is pain in the eye. So most glaucoma does not cause pain, but if you have sudden onset of pain in the eye, especially associated with sudden vision loss, that's an emergency. So you've got to get to the doctor right away.
And right, we've got some of the symptoms up here, some of the signs of glaucoma on our screen right now, but obviously you want to get checked. Who's at risk for glaucoma?
Yeah, there's a couple of groups in particular. African Americans. Glaucoma is actually the leading cause of blindness in African Americans. It also runs in families. So if you've got a family member that's had glaucoma or even just increased pressure in the eye, then you want to get checked out as well. And then it does become more common as you get older. So after age 60, we see a pretty big jump as well. And then like a lot of diseases, diabetes is definitely a risk factor. So anyone with those risks should definitely be seeing an eye doctor to get a dilated eye exam at least every 2 years.
Not a bad idea at all to go get checked out. Certainly some good information there. Thank you so much for joining us this morning. We certainly appreciate it.
Thanks. Have a good weekend.
You too.